joining us today. So, a couple things. Our focus here in Snohomish County continues to be on getting as many vaccines into the arms of people as quickly as we can, and that's been our goal for quite some time now. As I've mentioned before, we've been planning for vaccination sites since July. So we do have enough capacity, plenty of capacity to deliver vaccines, and we have the ability to stand up even more to handle any increase in our vaccine supply. So we continue to make the case every week to the state that we need more vaccine and can deliver it quickly and effectively. And when they send us more, we'll get more shots into people's arms. So top priority for us. I know it's really frustrating for people who qualify and haven't been able to get an appointment. As soon as we get a bigger supply and one that is dependable from week to week, we should be able to move through this phase quickly. So we absolutely know that vaccination is really our end game, and it's how we most quickly get the pandemic behind us and provide protection for our residents and get our businesses back up and running fully. So I know nobody likes waiting on hold or having to frequently check a website for availability. Really wish there was an easier way, but until we have confidence in the number of doses we get each week, we will only take as many appointments available as we have doses. Any other system would be worse. So we didn't want people waiting in long lines in their automobiles with no certainty that when the line shortened, they would get a vaccine. So we went to a appointment system right off the bat. So if you have an appointment, there will be a vaccine there for you. I really also encourage, we're pushing the curve down for the third time. Numbers looking good. We had a record-setting spike this winter, but it seems to be responding to people's efforts to wear masks, maintain distances, and follow the protocols. So we need to keep that up. And as more and more people are vaccinated every day, we'll be moving closer to recovery. So we just need to be patient and keep at it. We also now have mobile teams out in the community, making sure our most vulnerable residents are being vaccinated. We have mass vaccination sites with the capacity to move tens of thousands of people through them every week. And our healthcare partners continue to vaccinate people every day. We also have pop-up vaccine sites for harder to reach communities that are in the final stages of planning and will be deployed as we get more vaccine. So once we get more, we'll be able to meet the significant demand of the community and get those sites up and running also. I also want to take a second just to really thank the Boeing company, and good to see Brad here today, but we very, very much appreciate the partnership with the Boeing company. We're very proud to have them in our community. And as you'll be hearing, the site at Painfield, the mass vaccination site at Painfield, has been moved over to the Boeing Activity Center, and had a chance to view it the other day. It's a great setup. And again, we're so appreciative to Boeing for that partnership with us in the health district. So with that, I'll hand it over to Dr. Spitters from the Snohomish Health District.
Thank you, Executive Summers, and good morning again, everyone. We started this week with a small decrease in the 2-week case rate, dropping from 178 to 173 cases per 100,000 for the 2-week period ending on Saturday, February 6th. The next report for the roadmap to recovery will be out this Friday, and we need to continue to meet at least 3 of the 4 metrics to remain in phase 2. Again, those metrics are the 2-week case rate, testing positivity rate, ICU, intensive care unit capacity, and COVID hospitalizations per capita across time. We need to be stable or decreasing in 3 out of 4. Ideally, I would say decreasing in all 4 as we move ahead. It's easy to feel like we're on the other side of this, and in many ways we are, with decreasing numbers and more vaccines arriving daily, but we cannot let up. Now is not the time for complacency. Although case rates are more than 60% down off of their peak of 444 in mid-December, the absolute level of transmission is still high and a sideways trajectory, as we've seen in the last week, is far short of what we have been able to accomplish in the past and what we need to accomplish for the health of the community and our society at large. Now is the time for buckling down and following all of the public health measures. Every time, every outing, every get together with friends or family that you don't live with. And this is true even if you've been vaccinated. We like to think of the vaccine like a bicycle helmet or seatbelt. It doesn't eliminate the risk of injury, or in the case of the vaccine, of getting sick, but it significantly reduces it. Still, even with a bike helmet or a seatbelt, you stay in your lane and observe safety signs and signals just like everyone else on the road. Speaking of vaccines, I'd like to share some preliminary numbers and updates. Last week, another 23,000 people were vaccinated, receiving either their first or second dose in Snohomish County. Those 23,000 vaccine doses bring us to almost 86,000 total doses given in the first 8 weeks of the campaign. Just over 70,000 individuals have received their first dose, and almost 15,000 are now fully vaccinated. Roughly just under 10% of the population that has been vaccinated in Snohomish County, at least with their first dose, is very comparable across states. I was looking at a map yesterday where most states are in the 9 to 11% range. So although we all want it to be moving faster, we are moving at a rate that's comparable to the rest of the country. For this week, we are anticipating receiving 21,000 doses. Of those, about 10,000 are for first doses and about 11,000 are for second doses. We know people are still very anxious and trying to find an available appointment, as Executive Summers mentioned, and it can be frustrating, the whole process of trying and then not getting a spot. This is definitely a pinch point in the process, and the Health District and Snohomish County are working together to address this from a few angles. This includes the measures that Executive Summers mentioned, community engagement efforts such as mobile vaccine clinics and outreach to underserved populations. We are also working to improve access to appointments. Now that there is a bit more predictability in vaccine shipments, the Vaccine Task Force is trying to move towards setting days or windows when new appointments are added. A new system for scheduling appointments is slated to come online this week. Not only will it allow people to schedule their first and second dose at the same time, but it also has some limited waiting list capabilities. Last, the Health District has a call center at 425-339-5278 that operates from 8:30 a.m. to 4:30 p.m. Monday through Friday. Individuals unable to register online due to difficulty navigating or accessing the internet can also attempt to get assistance registering through that line. Again, that number is 425-339-5278. I will say, for those of you that have access to the internet and can navigate fluently, that is the most expeditious and efficient way to register. And we urge those of you who can do it that way to leave the call slots available for those who cannot. We have been working to expand capacity over the last week to help decrease waiting times. Seniors without internet access may contact the call center for assistance in scheduling an appointment if any are open, or to get added to a list for one when slots become available. Having said that, again, our fundamental bottleneck is the size of the eligible population being roughly 10 times greater than the weekly vaccine supply. So even with a perfect barrier eliminating registration system, many people attempting to register for vaccination this week will not be able to get an appointment this week. But don't stop trying. Be patient, keep trying. Our goal remains a reasonably orderly and equitable rollout of vaccination to all Snohomish County residents, but it's just a fact of life that this is going to take time. And I view it a lot like playing baseball. You go up to bat and you don't get a hit every time, but if you keep going up to the plate, eventually you will get on base, and eventually all Snohomish County residents that want a dose will get one. So at this point, I'd like to turn it over to Brad Zaback with Boeing to talk about the exciting new partnership at the Everett Activity Center. I was out there last week with Executive Summers and the rest of the team, and I too found it very impressive and just a great site for getting lots of people through over time. And so we're thankful to Boeing and Snohomish County for working together with us to help get that going. And with that, I'll turn it over to Brad.
Thank you, Dr. Spitzer. Good morning. Thank you for having me this morning. Boeing is proud to support the Snohomish County Vaccine Task Force efforts to increase public access to the COVID-19 vaccine. And we've provided the Everett Activity Center, which is the first indoor facility. It has already, in the first few days, vaccinated over 1,800 people from Snohomish County, and ultimately it has the capability to do 10,000 shots a week at that facility. Our team is excited. We have always been a vital part of the Puget Sound community in Puget Sound, and we're committed to doing our part in this effort as we move forward to provide whatever resources we can to enable quickly and safely vaccination of all the folks in the community as they're eligible. We continue our discussions with state and other local officials, and in other sites we'll continue to have that dialogue, but this is a great first step for us. And again, we couldn't be prouder to team with Snohomish County. They've always been a great partner, and we will continue to do everything we can. And with that, that's it for this morning.
Great, thank you, Brad. Yeah, it's a great site out there. Really appreciative. Finding a large space, indoor space like that is not an easy thing, so we very much appreciate it. Good job. All right. So the first question, probably for Dr. Spitters. So today, the White House said it's increasing weekly vaccine dose distribution to 11 million total. That's a 28% increase from a few weeks ago. Is Snohomish County expecting we're seeing that level increase in dose distribution compared to a few weeks ago?
Well, I would just share with you the numbers, which roughly were, I think, if we count a couple weeks ago, last week, and then this week, we go from roughly 9,000 to, I think it was 17,000 last week, and now 22,000 this week. So the trajectory is in the right direction. The absolute level, we want to do better, and we'll take every increase we can get, but so far so good. The trajectory is indeed moving in the direction you suggest.
Yeah, and just a reminder, I know this is familiar, but the federal government gives allocations out to the state, and then the state gives allocations out to us. So there's a couple of steps in the process. That's often, there's some decisions that are made before our allocations are given to us. So let's see. Has the county received any updates from the state about the 3-week forecast for vaccines, I think? Also, states are supposed to be receiving special syringes to get extra doses from the Pfizer vaccine. Are we getting those, and how much of an impact do they have on supply?
I have nothing to report on either of those accounts. We'll let you know as that evolves.
Yeah, I don't have any information either. I know there's an intent by the state to get us on a 3-week advance notice schedule, but that has not happened yet. So we're still on a week-by-week notification of what the next allocation will be. So the next question, is there a chance you may not meet 3 of the 4 metrics in the roadmap to recovery and slide back into phase 1 on Friday?
Well, I think it seems unlikely to me based on just tracking the data to date. Our EPI team will work through that data. And again, this is, I should step back and say that some of these metrics, they're all measured by the state using data that they can access independently. So this is no longer us feeding them information. And but from what I see and the timelines they're on, I would be surprised if there's any move back. We're either stable or decreasing on all 4 accounts at this time. So I'd be surprised. So stay tuned, but I think the outlook is good for us to continue in phase 2 through the coming weeks.
Next question is, does the county have plans for a 4th drive-through vaccine site? And how many doses from this week's allocation are headed to the existing sites? So I think the second part of that question is going to our mass vaccination sites versus maybe other providers. But yes, we do have plans for several other drive-through sites. We're holding back on those until we get more vaccine doses, but we can scale up rapidly. The existing sites have more capacity, frankly, to deliver vaccine than we have vaccine, so it doesn't make any sense to stand up additional sites until we get an increase there. Doctor, do you know general allocation between our drive-through sites and others?
Well, we are just getting even the gross aggregate numbers I just shared during my remarks were just fresh out of the email from the state, and so I haven't seen them, and we'll update through the week as that evolves, but I don't have the breakdowns yet.
Okay. And for Dr. Spitters, does the county, let's see, how concerned is the county about a fallout or resurgence from the Super Bowl causing more of a spread of the virus, especially with the new variant circulating?
Well, of course, any whether it's a holiday or the Super Bowl or whatever the next opportunity for folks to gather in the way that we traditionally do creates a concern that folks will let their guard down and get too many people together and not wear face coverings or both and all that. So time will tell, and that's something that's all in all of our hands individually and collectively to try to not let those events, try to enjoy them, but wisely and not let it derail our progress. And we'll see in the coming week or two how that went.
It seems like the county is seeing a big increase in doses administered per week. How encouraging is that? And I'll just start on this one. Any increase is welcome, but frankly, I won't be happy until we have all our mass vaccination sites up and running and fully booked, and I'm not getting any more calls by frustrated people who can't get appointments. That's when we'll be happy. But it's encouraging, and we're grateful. We know this is tough on everybody. It's really not only a nationwide problem, but a worldwide problem. So it's just going to take some time, patience, but I really would like to see enough capacity that we could stand up those other sites and fully utilize the sites we have running. Doctor, you want to?
Only to say that it's similar tone. The trajectory's in the right direction. It's very encouraging. It's short of our goal and what we want to meet to get this rolled out as quickly as possible and reach all zones. And the health district is tremendously grateful to the county, Department of Emergency Management, Boeing, other community partners that have shouldered burden, EMS, for example, Seattle Visiting Nurses to team up with us and try to get this done. And we've made a lot of progress, and there's many miles to go.
Is it known how many people from other counties have been getting vaccinated at Snohomish County's drive-through sites? How or does the county try and only vaccinate Snohomish County residents?
Well, I believe that our emphasis and our goal is on individuals who reside or work in Snohomish County. You know, I imagine that people from other counties are either because they work here, or we're vaccine shopping, might end up in line here. Again, I think I don't think we're recording addresses. We got to make progress, and I think while we don't want too much shifting across county lines, I think some of that is inevitable, and my personal opinion is, in general, let's keep making progress on the total number of doses given. And if we do that and our neighbors do that, the small number of people that move across county lines is kind of inconsequential to the overall goal that we're trying to meet.
Okay. So as schools reopen, data report says infection risk for schools is low. Is the literature on that drawn from a location that already reopened schools fully? Schools here have been mostly empty until recently. So what is the current understanding about school
Right.
settings?
So let's move from the local, the micro, to the national or the macro. At the micro level, we see cases in schools. We don't see much transmission in schools. Most of the episodes of a notification of a case from a Snohomish County school are a single case, and we don't see further spread. There are occasional clusters of cases, but nothing that gets into the even above 5 or 10 cases. It's just been small. And when you look, and even even when there are multiple cases in a given school building, it doesn't mean transmission necessarily occurred there. So we have to take that into account and find that reassuring. Having said that, as you say, we're not at full occupancy of schools. If you look at the nationwide and even worldwide data on this, though, it's really very reassuring that there's just not much transmission going on at all in schools where the prevention measures that are in place here are also in place. And so again, the overwhelming preponderance of scientific data, as well as our empiric data here with our early steps at reopening schools, is very reassuring. And there you have it. So we continue to encourage schools to gradually, slowly, incrementally return kids to grouped, cohorted, hybrid, meaning part-time home, part-time school. So we're not looking at full occupancy, but we are looking at increasing the number of grades and moving toward older ages, as long as this continues to go well.
And I think the last question here is related to that. You've addressed partially if there are reports of more children getting COVID or getting sick from it. Are we seeing that here in Snohomish County at all?
Well, through the end of January, all case rates in all age groups were down. I'm not aware of any either anecdotal, reports from, say, Seattle Children's or other facilities serving children of an increase in severe cases or hospitalizations. So, we continue to watch that, but as of now, case rates are down in all age groups.
Right. Don't see another question. I wanted to mention one thing about the indoor site at the Boeing Activity Center. We're working with community transit to get shuttles to that facility eventually, so it should be accessible by public transportation fairly soon. I don't think that's happened yet, Brad, but I know that's in the works right now. You drive to the facility, there's plenty of parking. It's really a nice setup, but we are working on public transportation to that site also. Is that still the case, Brad, do you think?
Yeah, as far as I know.
Yeah. Any other questions? do you have any more information on what the pop-up sites will look like and what people should be looking for? Doctor, do you want to address that?
Yeah, well, I think at the conceptual level, these would be sites trying to reach communities that have, for a variety of reasons, either high risk of severe disease, high risk of exposure, who meet the current eligibility criteria, but who are disadvantaged in terms of accessing vaccine either through the mass sites or through the routine healthcare system. And so the outreach for that would generally be targeted to that population through community-based organizations where the pop-up site, if you will, would show up, say, for a day or two, utilizing a variety of partner resources to provide vaccines for a day or two to that community. So it's the kind of thing, I think, where the marketing would be targeted to the community. So it may not be something that it'd be transparent, but we'd really target our notification efforts to the people that meet those criteria and that are served by the community-based organizations that are our conduit to reaching that population. At the detail, logistical level, I can't give you much more information than just what I've shared conceptually.
They very much look at like smaller scale of both our outdoor sites and indoor sites too. We're working with a number of partners on what type of facilities are available, but I do know we've talked about and planned for both outdoor small scale mobile sites and indoor facilities also. Let's see, would mobile pop-up address people who can't easily leave their homes?
Yeah. Well, I think this is a challenge that's been brought up from many. Your question, we hear it from people in the community, from healthcare providers, and it's a challenge to reach people who are truly, unable to get out of their home for healthcare, because that is in terms of equity, it's something that we do want to reach those folks to protect their individual health. On the other hand, it's a very inefficient, and I'm not discounting the need to do it, but it's the kind of thing where there would need to really be outreach to individual homes. And so we're still looking at how that would look and how to set that up, because you're really talking about going to someone's home, vaccinating them, waiting the 15 to 30 minutes that you need to wait to observe them, and then moving on to the next place. So that's still a work in progress. I think we are in communication with community-based organizations serving elderly and homebound adults to try to develop that. For those who can, who are mobility impaired, but who can get to a healthcare facility, then paratransit and that sort of thing could help mitigate those barriers. But it's not an insubstantial challenge, but we're continuing to try to work on it.
I think that wraps us up.
This is Kristen in the Joint Information Center. Thank you again for joining us today and for your questions. We are going to go ahead and wrap up. Please stay tuned for future media availabilities.